Britain just secured an experimental Japanese antiviral for Andy's Hantavirus, and we still do not have a single updated case number to hang that on.
I'm Brian, she's Cassidy. This is Hantavirus Watch. And today the treatment gap finally has a name. Ushuaia is bleeding tourism dollars, while the exposure window is still open. And Virginia's health department just posted a public advisory we need to look at.
We're also doing a step back on why Spain quarantined and the Netherlands monitored. Same ship, same voyage, very different protocols. And we finally have enough detail to push on that. Here's the Economic Times.
Britain has received experimental favipiravir from Japan to treat a deadly hantavirus outbreak. The drug is not licensed in the UK, and its use for hantavirus is experimental. The outbreak involves Andes virus, which can spread between people. Health officials confirm no increased transmissibility or pandemic risk.
Picking up yesterday's treatment question, the UK Health Security Agency confirmed over the weekend that it accepted delivery of favipiravir from Japan. That's the drug, favipiravir. It is not licensed in the UK, and UK HSA is still calling its use for hantavirus experimental. So yes, Britain got the drug. But no, that is not the same thing as a confirmed treatment.
Favipiravir is a broad-spectrum antiviral. It was developed in Japan for influenza. So I want to know one thing. Is there actual Andes strain data behind this? Or did Britain just grab the closest antiviral on the shelf and label it a hantavirus response?
That's the clinical gap. UK HSA said the supplies would bolster treatment stocks, which sounds like stockpiling or maybe compassionate use planning, not a Phase 3 result. And in the same statement, they said there's no increased transmissibility and no shift in pandemic risk. The procurement is real. The evidence behind it still isn't named.
For every Hondius contact still inside a 42-day symptom watch window right now, in Virginia, in Spain, wherever, the real question is whether this drug is actually available if someone deteriorates, or whether it's sitting in a British warehouse waiting for a licensing conversation that hasn't happened yet. These people were on the same ship, so why is Spain putting them in strict isolation while the Netherlands lets them take walks outside? What's the science that's driving those different calls?
It comes down to two things: how much uncertainty still hangs over Andes strain transmission, and how each country is reading the same WHO guidance. The WHO recommends 42 days of monitoring and quarantine, at home or in a healthcare facility, and that leaves real room for national discretion. Per reporting in El País, Canada initially set 21 days of isolation with a plan to reassess. The Netherlands is allowing home quarantine with outdoor walks, and Spain went stricter. Meanwhile, NBC News says 18 Americans are now in quarantine at 2 federal centers, and officials are still interviewing them to pin down how close each passenger was to confirmed cases, because proximity and contact duration are the variables that actually change the risk tier for any one person. The 38 Filipino crew members, according to the Manila Times, are in a mandatory 40-day quarantine in the Netherlands under international health protocols. So you've got one WHO recommendation and at least 4 or 5 national implementations. That gap is the uncertainty. Andes is the hantavirus strain considered more transmissible between humans than the others, and officials are calibrating caution to what they still do not know.
So if the U.S. interviews actually nail down who was close to whom, that could push American officials toward loosening or tightening those federal quarantine rules?
Exactly. NBC News says how long Americans stay in those federal centers, and under what conditions, is still unsettled and depends on what those exposure interviews show. What to watch over the next few weeks is whether any secondary cases turn up among contacts who were not on the ship. That's the signal that would force countries to tighten restrictions across the board. Until then, the national split is probably going to hold. And if you were on the Hondius or think you were in contact with someone who was, follow your local health department and talk to a clinician instead of waiting. Here's Travel and Tour World.
The hantavirus threat has alarmed global health authorities after a deadly cluster emerged on board the Dutch cruise ship MV Hondius. The vessel departed from Ushuaia, Argentina, widely known as the southernmost city and a primary Antarctic cruise hub. The outbreak has prompted international attention, travel disruption, and coordinated health interventions.
Travel and Tour World was date-stamped May 19 out of Ushuaia, and the frame here is economic alarm, not new case numbers. The Argentine Health Ministry's exposure site bracket is still open from May 18th, which means investigators still cannot rule out any stop on the Dutch couple's road trip through Argentina and Chile. So the reputational damage to Ushuaia as an Antarctic gateway is moving faster than the epidemiology.
Right. And what I want to know is what the actual cruise operators are telling people who already have future departures booked through Ushuaia. Not the broad concern, the next sailing. Has anyone cleared the port, or have they just gone quiet and hope passengers won't notice?
That's the gap in this piece. The WHO case count has not moved. 8 confirmed, 2 probable, 3 deaths. And that silence matters, because Ushuaia's tourism industry is taking reputational damage faster than the epidemiology can catch up to it.
12 passengers or crew in that excerpt is a number worth flagging, because the WHO denominator we've been using all week is 10. If this piece is working from a different count, I want to know whether those are confirmed cases, suspected cases, or just monitored contacts getting folded in without a label.
From Kathy Lamb at Virginia Department of Health.
Antivirus can spread to people in several ways. By contact with infected rodents or their urine, droppings, or saliva. By touching an object or surface contaminated with the virus and then touching your nose or mouth. Through close contact with a person who is sick with Andes virus.
Virginia Department of Health posted this on May 19th, specifically the Norfolk Health District, and it does something CDC's public FAQ still has not done cleanly. It names Andes virus by strain. It lists person-to-person transmission as a documented route, and it puts that 4 to 42-day symptom window into plain language for a lay audience.
Virginia is one of the 16 states with monitored contacts, so I want to know whether this page came with anything operational attached, testing protocols, a hotline, a clinic referral path, or whether Norfolk just posted, "Risk is very low, travel as planned," and called it a day.
What the excerpt gives us is public education framing, not a surveillance update. The risk characterization is VDH's own language, not a CDC or WHO quote. So I'd hold that very low against the fact that the WHO case count has sat at 8 confirmed, 2 probable, 3 deaths for several days now without a denominator update.
Right. Very low for the general public, and what do I do if I was on that ship are 2 totally different questions, and this page does not seem to separate them.
If you follow Hantavirus Watch for steady, detail-focused updates, try Arcadia Mayor Spy Watch, daily court watch on the federal foreign agent prosecution of former Arcadia Mayor Eileen Wong and the related Yaoning Mike Sun case. Find it wherever you listen to podcasts. You'll find links to all the stories we covered today in the show notes. So if one caught your attention, you can take a closer look there. That's Hantavirus Watch for this Wednesday, May 20th. This is a Lantern podcast.